The federal Conservatives are calling for an emergency debate on safe drug supply after the BC government asked Health Canada to empower police to act when they see illicit drug use in public. Well, harm reduction groups say the move is unethical as it would largely affect those who are poor and homeless with nowhere else to go. The 3-year decriminalization pilot project started in January of 2023, exempting those who are in possession of small amounts of opioids from facing criminal charges. Well, last week, the province said it was working to urgently change the policy to stop drug use in public places like parks, transit, and hospitals. And CTV's Colton Prale joins us live with more on this. Colton, let's talk about why the BC government is walking back one of the country's most progressive open drug use policies. Are they admitting that this was a mistake?
This is something that was new, that wasn't really trialed in Canada before this, Jamie, and so there are adjustments. That's the word from Health Canada. It's also the word from experts. Adjustments that needed to be made. Part of this trial was open use of illicit drugs, and there has been a number of concerns, whether it be from healthcare workers who see drug users using in hospitals, patients themselves even at times, and the safety concerns that come with that. There have been concerns about police ability to deal with situations that may escalate into creating unsafe situations for either users themselves or the people around them, and their ability to have the tools to respond to those situations appropriately. And so that's what BC is highlighting, the ability to give law enforcement, to give healthcare workers a little bit more safety, while also understanding that this is unlikely to have a significant impact on either drug use or the toxic drug crisis itself. Recriminalizing the use of these drugs won't diminish their consumption, according to most advocates and experts. And so there are genuine fears that by recriminalizing, you could lead to higher deaths. This is something that BC tried to institute last fall, and then a judge on that basis, on the basis of potentially causing irreparable harm, disallowed them from doing so. And so now, rather than doing it through the legal route, they're trying to make these changes through Health Canada to bring in this recriminalization. And so this isn't necessarily a sign that the policy has failed, but perhaps that there weren't enough guardrails around that policy to ensure that it balanced the objectives it wanted while also making sure that any potential harm to the community was minimized. But what this has done, this major reversal, has also brought a larger discussion to the fore. We're not just talking about BC's policies anymore. We're now, thanks to the Conservative leader, talking about the federal government's drug policies and whether or not there needs to be a reconsidered approach across the board. While BC is focusing specifically on decriminalization, Pierre Poilievre is taking aim at not just decriminalization, but also safe supply and the entire suite of drug policies from the federal government, and he's calling for them to be dismantled entirely.
The Conservative leader has called this program a complete disaster and has stated that there's been a 300% increase in drug overdose deaths in BC since Trudeau took office, according to Mr. Poilievre. We're going to have a lot more on this story throughout the afternoon. CTV's Colton Prale, we appreciate that update. Thank you.
Anytime.